Good afternoon. Presenting my study, serum free light chain assay as a prognostic marker in patients with aggressive B-cell non-Hodgkin's lymphoma and its impact on survival outcome. Next slide, please. Next slide, please. So B-cell lymphoma, being a lymphoproliferative disorder, is characterized by B-cell proliferation and dysfunction and can be associated with production of abnormal immunoglobulin. Hence, serum-free light chain could have a potential role as a prognostic marker in these diseases. The objective here was to study the free light chain abnormality in patients with newly diagnosed aggressive B-cell NHL who were treatment naive and to correlate the same with the survival outcome. Next slide, please. This was a prospective study conducted over a 2-year period in the Department of Medical Oncology at Regional Cancer Center, Trivandrum. All the patients who were included in the study after an informed consent had their free light chain level estimated prior to initiation of treatment. Elevated level is defined as kappa more than 19.4 or lambda more than 26.3. An abnormal kappa by lambda ratio was defined as a value less than 0.26 or more than 1.65. Next slide, please. So we had total of 100 patients included in the study. That means the number here corresponds to the percentages also, with a median age of 53%. The most common histology was diffuse large B-cell lymphoma, with 60% of patients in the advanced stage of disease. Coming to the free light chain abnormality, the abnormal ratio was seen in 12% of patients, while elevated free light chain level was noted in 38%. And the most common was polyclonal elevation, characterized by both kappa and lambda in 26 patients. Next slide, please. All the patients went on to receive the first-line chemotherapy. R-CHOP was the most common regimen in 79% of patients. 28 patients had a relapse of disease and received the second-line chemotherapy in 26 patients. The most common regimens preferred here were DAP and ICE chemotherapy protocols. Next slide, please. So after a median follow-up duration of 75 months, we could see that the 5-year relapse-free survival was 50.44% and overall survival was 61.3% in the entire cohort. It is noted here that advanced stage and advanced stage of the disease corresponded to an inferior relapse-free survival with a significant p-value. Next slide, please. So the variable of this study, that is the free light chain abnormality, it was seen that patients who had an elevated free light chain level had an inferior relapse-free survival. The 5-year relapse-free survival was 50% in patients with an elevated level as compared to 71.4% in patients with a normal level with a significant p-value and a hazard ratio of 2.1. Also, patients with the abnormal free light chain ratio had an inferior both 5-year relapse-free survival as well as an overall survival. The absolute difference was almost around 10% with a significant p-value. The hazard ratio of the EFS associated with abnormal ratio was 2.63 and for OS the hazard ratio was 2.70. Next slide, please. So concluding my results here of the current study and comparing with the previous studies available for comparison, we can see across the 3 groups, the study population was slightly different. The distribution of free light chain abnormality was almost similar, with 38% having elevated ratio, around 12 to 14% having an abnormal ratio. The studies published in Blood by Matthew et al. In 2011 had shown that elevated free light chain ratio had a strong correspondence with the inferior survival, while abnormal ratio had only a modest effect on survival. So here I would like to conclude, in patients with newly diagnosed aggressive B-cell NHL who are treatment naive, abnormal free light chain ratio and elevated free light chain level is associated with the inferior relapse-free survival and can be considered as a potential prognostic marker. Thank you.